okay? I'm also fortunate enough to serve on Baptist Healthcare Systems Board. So I've been fortunate with the help of Jared Coleman and other leaders with Baptist Health System to kind of learn the backstory of a lot of this. But I've also learned how devastating it's been economically on our healthcare system, as well as how hard it's been on the people that work in our healthcare systems. I want to personally thank the individuals that work in healthcare, and especially I want to thank the three panelists we're going to have here on all the efforts they're putting forth trying to help us all stay safe and healthy. With that, it's hard to believe it's been almost 6 months into the COVID pandemic. We have seen businesses close. We have also seen the resiliency of our community as we have come together as a task force to help where possible. I'm proud of our accomplishments to date, which includes the creation of a crisis support hub to serve as a one-stop shop for businesses that need guidance and policy recommendations at the local, state, and federal levels to help businesses recover, and development of a healthy workplace in Greater Louisville, and much, much more. But much more remains to be done. I have 3 areas that we're focusing on that are priorities. Number 1, focus GLI's efforts on getting cash and capital to small and mid-sized businesses so they can hire and accelerate the economic recovery. This includes continued advocacy for federal programs that will help in our economy. Number 2, to help ensure sustainability of Kentucky's unemployment insurance trust funds and to protect employers from UI tax increases in January of 2021. The state seeks to restore the trust fund to solvency. Federal CARES dollars have been granted to the state, and we are hopeful that some of those funds will be used to shore up the trust fund and help stabilize the trust fund going forward. Number 3, to unite support necessary to get people back to work safely and securely. This means the support of mask wearing, advocacy for legal liability protection for employers, and bold actions to stabilize the child care systems. As I said, much more remains to be done to get us all back to work. Today, we want to focus on some of the data behind where the cases are coming from. Now, I would like to welcome our esteemed panel to today's important discussion. Dr. Sarah Moyer is the Director of Public Health. She also serves on the faculty of the University of Louisville School of Medicine in the Department of Family and Geriatric Medicine, where she is an assistant professor and director of quality improvement. Connie Mandel is Louisville's Metro Public Health Deputy Director, and Heidi Margulis, chair of the Louisville Board of Health, elected in 2020. Heidi is also retired Chief Corporate Affairs Officer at Humana. Before I turn things over, I'd like to give you an outline about today's discussion. After the discussion today, we will be taking questions from you. Please use the chat feature located at the bottom of your screen. Our team will sort through the questions and try to cover as many topics as time allows. We have also received a few questions in advance from the Renewal Task Force and others. For a summary of today's discussion or access other COVID-19 resources, please check back and visit greaterlouisville.com. With that, I would like to turn the program over to Dr. Moyer, Connie, and Heidi. I'll turn it over to you, ladies.
Thank you so much. This is Heidi, and we're honored to be here with you. And let me issue an invitation for a continuing dialogue that puts us as community partners and as we go forward, not only through the COVID crisis that we're in, but on other issues of public health interest. Let me begin with the end in mind, and I know that Dr. Moyer and Connie will share with you the workplace impact and provide information and resources to you. We are, as a board, and especially today was our board meeting, focused on ensuring that in addition to COVID, we protect our fellow residents from the flu, because flu plus COVID is not a good mix. I know that many of the board members and partners of GLI have traditionally provided flu shots on site for their employees, and that those employees maybe work at home during the flu season. And so I encourage the companies to provide information that we will be happy to supply through the health department to companies. And it will also be on our website as to where flu shots can be secured throughout the community, especially in hotspot areas. So with that in mind, I am going to turn it over to the clinical experts and the person who is the workplace and business contact, Connie Mendel. And so Dr. Moyer, will you lead off this discussion?
Thank you, Heidi. So yeah, thanks for that introduction, and thank you for having us here. Really appreciate the invitation and ability to talk to our workplaces directly and to hear what kind of questions you guys might have and have that opportunity to talk to Connie and I. So yeah, Sarah Moyer, Director of the Health Department, and with me, Connie Mendel, our Deputy Director and Overseer of our emergency response related to COVID, and also Director of our emergency preparedness, our environmental teams, and our labs. So you've got the head of both of our departments here today. So just wanted to start by going over the data. If you just encourage everyone to keep up with the latest data that's going on with COVID from our webpage, and I apologize because I clicked to share just the PowerPoint. It doesn't want to hyperlink over to the webpage. But if you go to /LouisvilleKY.gov/health, it pulls up our data website, and just encourage you to keep up with the latest data there. And let me see if I can get there. Here we go. Are you able to see my current screen? Okay. So over 12,000 cases, 292 deaths, and over 7,000 people have recovered from COVID in Jefferson County. Keep in mind that we get data reported to us at many times during the week, not always the latest stuff, and so you might see these numbers jump tomorrow or other times, and that's just when we get labs reported to us at the health department. We keep track of it by a gauge measure, and you'll see here that we are in the red, and that is because there are way more cases right now than what my public health team can keep up with. So over 1,000 cases being reported every week here in Jefferson County. Before COVID happened, we had 5 people on our team that covered all infectious diseases, did the case investigations for that. And so over the last 6 months, we've really ramped that up. We have a contract with Lacuna right now, and they have ramped up to 146 people, which could have kept up with the 200 cases a day back in early July, but not able to do that for over 1,000 that we're seeing. And so that's just part of the reason why we are in the red. We are widespread COVID happening in Louisville, in Jefferson County, and so just have that warning out to the public. Our total deaths, keep in mind, like the last 2 weeks probably aren't accurate, so we're starting to see a little bit of a trend up in total deaths, but still down from deaths per day that we were seeing in April. And then the positivity rate, it's here on the webpage. Just caution you, this causes a lot of confusion. The positivity rate that we are showing here on the webpage is positivity from the entire pandemic. So this is every single positive test divided by every single negative test that we know about. And because labs don't have to report every negative test, there are some that we don't know about. And so just caution you on that. And you can see that it's very different than the number that the state health department does, which is just the last 2 weeks. Because ours is the whole pandemic, the number is slower to rise and slower to decrease. So just caution there. And then zip code wise, we have a map of excluding long-term care facilities so people get a better idea of where, what communities it's happening in. Also caution you, this is from the entire pandemic. And so this is where COVID has been, not necessarily where it is this second or where it's going. And so that's it, just a great place to go to if you're, you need to know where a testing site is. There's a link there, symptoms to look out for, and check there. I know you probably heard in the news a few weeks ago that testing was not able to, we did not have enough testing capacity. That has greatly improved in the last couple weeks. And so anyone who has symptoms, any of those symptoms that are listed there, please encourage your employees to go get tested. Fever, cough, those are the big things that we talked about in March. Now some of those smaller symptoms like diarrhea or sore throat, headaches are what we're seeing more in people. And so just encourage any symptom. If you got 2 or more of those symptoms there, please get tested. If you're a contact to a case, we're encouraging testing as well. And then one of the reasons why we are in the red is that we don't have enough contact tracers. Contact tracing, great video here if you haven't seen it. But the goal is that anybody who has been exposed to COVID, that we know who they are and we have them isolating alone in their house. If they don't have housing, we can help them with housing, or a place, if they don't have a room to be able to isolate away from the rest of the family members, we can help with that when we call them. So we know where new cases pop up, and we're able to what we call box it in. And so it's just really important, even if we can't call you and talk to you, as long as your employees know that if they are sick, they need to stay home for at least 10 days. And if they have been in contact with somebody who is a case, that they need to be staying home for 14 days since their time of last exposure. And we define exposure as within 6 feet for 15 minutes or more. And I know Connie's going to go over that a little bit more, and we'll go into that in depth again, and we'll have slides for you. So just want to get that a heads up because we get those questions all the time. All right, so back to the PowerPoint. Connie's team, experts on the reopening plan and what your workplace should be doing, and so I'm going to turn it back over to her to kind of go over those pieces.
Great, thank you. So again, I'm Connie Mendel, serve as Deputy Director here at Louisville Metro Public Health and Wellness. So one of the things that we're going to talk about as far as avoiding COVID and reducing the spread, specifically from a business perspective. So there's a lot of information readily available. One of our big resources is the Kentucky.gov site. They're Healthy at Work, and they have provided a lot of reopening guidance, and along with that, mandates. So having a plan is the most critical part as far as whether it's a business that has been open this entire year, or reopened, or has reopened in stages. So each plan at a minimum should ensure social distancing within the facility, include testing, and that's testing at a minimum for symptomatic employees, but also potentially close contacts in the workplace of those symptomatic employees. As Dr. Moyer mentioned, that would be anyone that was within 6 feet for at least 15 minutes, whether they had a mask on or face covering or not. And also include, your testing plan could also include surveillance testing, monitoring, doing regular testing for the facility, and we do have a lot of businesses that are doing that. So in addition, the plan should include training. So that would be training on the social distancing and testing. Cleaning and disinfection of frequently touched surfaces is a big aspect of preventing the spread of COVID, whether it's in the workplace or home or places that we play. And communication is how you're communicating all of these pieces to your business. So each business should have something that's very specific for their operations. Every operation is going to vary, so these different aspects are going to vary within the different workplaces. But one of the pieces that tend to be overlooked is the designation of a healthy at work officer. So we kind of refer to that sometime as a hall monitor of sorts, and their sole responsibility would be monitoring and ensuring that the plan is kept up to date, that everyone is following this in compliance. And for some workplaces, that could be multiple officers. You could have one for each floor or sections, because the longer we're working and as longer we go through this pandemic, we tend to get relaxed and lax, and we get very comfortable. We love our coworkers a lot of times. We're very social people. It's hard to keep communications and conversations at a 6-foot distance. We get more laxed with our face covering, and wearing those two things tend to slip under the nose or under the chin, or somebody says, oh, when I leave my office, I'm just going to make a quick sprint out to the water fountain or the restroom, and we get into those tight areas where we're in close quarters and we forget our face coverings and that. So that's why designating that healthy at work officer is so critical. And like I said, there's a lot of information at kentucky.gov on the Healthy at Work site, and there's some very specific guidance to businesses. So whether that's retail, manufacturing, the entertainment, venues, there's some detailed plans, but those are just really minimums. We also encourage folks to review the information that's on the CDC website, and to stay in communications with your professional organizations and affiliations. I've seen a lot of great plans and documents shared, and who best to know your business and operations than your professional associates. We also encourage people to set up work groups together, whatever business type that may be, to build plans and sharing information. So if you want to go ahead and go to the next slide. Thank you. So there you go. So this is what was created as far as the 10 rules to reopening or staying open, and these are still really great guidelines and things to go with. And again, some of these actually are mandates, but the things that we talk about to try to prevent spread and reduce those the cases amongst businesses is to continue telework as much as possible. And anything that can be done remotely, even training. We're doing a lot of work with using WebExes and Zooms for where we used to do in-person training, where we're doing on-the-job training or onboarding. Phased work, only do as much as you can do. One of the things with social distancing is we've got to spread out. So we want most areas that, whatever the capacity is, it should be cut in half at a minimum to allow the space between folks. Screening, health checks and screenings is mandated for all businesses, so that includes temperature checks and to ask the daily screening questions. Are you sick? Are you experiencing any of the symptoms related to COVID? Have you been in close contact with someone that is experiencing those symptoms? Has someone from the health department reached out to you to say that you're a close contact of someone who has tested positive? These are things that we need to do regularly at the beginning of each shift. Of course, in Kentucky, we do have universal face coverings, so those are required indoors anytime you cannot be 6 feet apart, and actually even outdoors when you can't be 6 feet apart. That's something that a lot of people forget. And to include, working, we have a lot of areas where people work, the waiting rooms, the cafeterias and break rooms, all of those sort of areas, and there's we're recommending to put in physical barriers in some of those areas to eliminate chairs, to spread out areas. The next rule to reopening or staying open is enforcing that social distancing. And that also includes a lot of signage in the area to remind people. Physical cues are great. It's a good reminder. Again, like I said, we are social people, so we tend to kind of gather together. So whether that's floor markings or wall markings or physically blocking some seating areas to keep people from sitting together, whether that's workstations, in the restrooms, or break rooms. Again, we're going to try to limit our face-to-face meetings. The last thing you want to do is to lose your whole sales force or accounting force because they were in a boardroom together, shoulder to shoulder, and then someone was sick. We are seeing a lot of community spread of the disease, which then leads to business and workplace spreads. You know, we see employees that are exposed through their children, whether that's through sports camps or childcare, or we're returning to school. And then again, like I said, those then can become workplace spread. So anything we can do to spread apart, to limit face-to-face meetings. Hand washing is always crucial, whether it's COVID or flu season. Having proper hand wash stations and sanitizer as a backup to that. Providing special accommodations to employees or customers that for some reason if they're unable to wear a face covering, you know, these are the people that you would certainly want to prioritize for working at home. And being in areas where they can be 6 feet apart from everyone else. And then again, the testing plan that I talked about on the previous slide. Okay. So that probably the most common question that we've gotten lately is, what do I do if there is a workplace case? And here's some of the details to that. So the first thing we want to do, an employee that has symptoms or somebody that's tested positive immediately need to be sent home to self-isolate. So if they're already at home, they absolutely should not be coming into the office. And then we want to clean and disinfect any of those areas that was used by the sick employee or the person who tested positive, and particularly frequently touched surfaces. And the CDC has a lot of guidelines or what are the most effective products to use, and that's also on the state, you know, and multiple websites and ours. So the next thing we want to do is identify those close contacts, those folks that work within 16 feet for a minimum of 15 minutes during the 2 days prior that their contact was symptomatic or 2 days prior to their test date. So with that, you know, you're going to want to review work schedules, duties, time clocks, PeopleSoft, any of those type of things, because we want to identify anybody who potentially COVID has been passed on to. And for those self-contacts, they also need to be sent home immediately to self-isolate. The next thing we want to do is notify other employees of a possible exposure, so that can be done through signage, through work emails, and just, you know, stating without disclosing the employee's identity that there has been someone at work who has been diagnosed or is suffering from COVID-19 symptoms. And that can be a more general message, you know, whether it's from the department. But for those that are close contacts, they will need to be specifically reached out to. But it can be more generally messaging for the rest of the employees. The next thing we want to do is report that case and close contacts to us, to our communicable disease team, and there's the phone number there. And with that, the information that our folks need is a name, date of birth, and the date and the location of the test. And then the next thing you want to do is activate your testing plan. So you can refer to our website as far as utilizing testing locations. You can certainly use your workplace medical provider, or, you know, some employers decide for their employees to use their primary care physicians. You just need to have a plan in place and be ready to activate that, because unfortunately, it's not an if, it's going to be a when an employee is either asymptomatic or positive, unfortunately, as all of our workplaces are reflections of the community. So as when can they return to work? So the person who had symptoms, they can return to work 10 days since their first symptoms, and they've been 24 hours without fever, without using any fever-reducing medications, so Tylenol, Motrins, ibuprofens, acetaminophen, and their other symptoms are improving. So they don't need to be symptom free at this point. They could still have a little bit of a cough or other things, but they need to be fever free. So for those individuals who tested positive but were not symptomatic, they can return 10 days after their test. And then the close contacts, those that don't have symptoms, they can return 14 days since their last exposure to the infected person. So that's why it's really important to have that information of when people worked and the shifts and the locations, so we can identify when that potential exposure was.
And I just want to jump in and add there, the goal, if you have an appropriate return to work plan, is that you would have 0 close contacts when you have a case. So we know people are going to get COVID. Our goal is to prevent any spread from happening in your workplace. And the best way to do that is that 0 close contacts. So it's just a good reminder, stop and think, I don't know, every time you're on a call with your team, like, make your team think about who they were within 6 feet for 15 minutes or more. The answer should always be 0. If it's not, help them think through what can be done. So that answer is 0. So we are not sending anyone home going forward.
Yeah, and that is actually, that's a great drill to, instead of fire drills or tornado drills, if you were to ask everyone today, give me a list of names that you were in contact with last 2 days with 6 feet, 15 minutes. And like Dr. Moyer said, let's hope in the workplace that answer is 0.
I've got a question that really is right in this wheelhouse. And I gotta make sure I'm interpreting what you're saying, and it was just sent to me. You're at the workplace, you got 12 people socially distanced, it's say a lunchroom. Later, one finds out they're positive. Do all 12 of them have to self-quarantine for 10 days if they work closer than 6 feet?
If they were closer than 6 feet for 15 minutes, they were not. No, see, if they were not within 6 feet for 15 minutes, they would not be considered what we call a close contact.
Gotcha. Okay. Thank you.
But you would want to go ahead and do some cleaning and disinfecting any areas that person touched or potentially touched.
Okay. Thank you.
Mm-hmm.
And here's just some great resources to help you through what Connie just talked about. So if you're an employee or in a workplace and your workplace is not following these reopening guidelines, please report that to Metro 311. Our team takes those complaints and goes out and investigates when that is happening, and the goal is to help them to come into compliance. So we help to educate, kind of go through the same thing that Connie just did today to help them come into compliance to prevent cases in the future. There's also, if you just have general questions about COVID and anything you might have, the General Kentucky Department of Public Health hotline is a great place to call there. And then you can also report any non-compliance outside of Jefferson County to that number, and that gets forwarded to the correct health department. And then if you are a case or you think you're a contact of a case and you have not heard from the health department yet, which, as when I went over the data, there's a good chance you have not heard. So if you haven't heard and you want to know what to do, you have questions, that's the number to call. It's 502-912-8598. And that number is staffed 24 hours a day. So as opposed to the number that Connie gave you earlier, that number is only staffed like 8 to 5, Monday through Friday, business hours. This number is staffed 24 hours a day if you have questions about contact tracing or cases. So I think with that, are there any other, well, here's another page with the helpline on it. Just help to get that word out, and that number is best if you're a case or a contact to a case and have questions.
Also, Dr. Moyer, I think that we will provide these slides so that people can have them at their disposal, correct? Correct.
Mm-hmm.
Yep, and then a lot of great resources as well, too, just for that Connie talked through, but our website, the state's website, just for both data, advice, guidance, too much, there's almost too much information out there, but these are some great ones that we recommend. So, and then our website also has great handouts so you could print, facts, posters, that sort of thing to put in your workplace. Same with the state website as well. I'll go back to the resources to end there. So with that, turn it back over to Sarah unless there's other questions right away that people have.
Yeah, we have some more questions. I'll kind of go through a few of them. You've answered some of them along the way. One of the questions was, are you still encouraging teleworking? And obviously we heard it because we're all trying to get our businesses back going and back interacting. But let me go to this one, and whichever person's appropriate to answer, you guys. Where are most of the cases coming from in Louisville? Is it the restaurant scene, small group gatherings, apartment buildings? Where are we seeing most of the cases coming from in Louisville specific?
Yeah, so cases are coming from everywhere. If you look at the data, probably the number one source is a category called household contacts. So that's your family members, other people living in your house with you, friends you had over, so people you had contact with your house. So that's where a lot of people let their guard down. They might not wear their mask. They might have people over to eat or drink. And so a lot of spread is happening that way. And then we are seeing workplaces, people reporting going to restaurants, gyms, churches, school settings, especially athletics, when the kids are close, don't have masks on, camps, spread as well happening. So really, it's everywhere. So anywhere that's not following our Healthy at Work guidelines is at risk of having a case, and we are seeing cases. So part of the reason why we're in that red is that it's everywhere and it's widespread, and so going to leave it there.
Okay, let me go to this. Will kind of dovetail into another question. Are you seeing an increase of cases in younger people contracting the virus, being hospitalized? Businesses are really being flexible with their employees and trying to see a direction there as it really relates to age possibly.
Yeah, we are seeing an increase in number of cases in our younger population. I think that's both a reflection of having increased testing capacity now, and so we're able to test people who have milder symptoms. Also, schools going back, they've got their own testing plans in place, same with athletics, and so more kids are getting tested. So yes, need workplaces to be flexible to make sure that parents can stay home with their kids, with their contacts, and it's a really long time that parent then has to stay home. So if you're looking at that, the kid has to stay for 10 days and then the parent has to stay for 14 days after their last close contact. I know as a mom of 4 young kids, there's no way I can stay farther than 6 feet away from my children. So, it's, 24 days potentially that your employee might be out.
Another question here is, has contact tracing been helpful in containing COVID in our community?
I would say COVID is not contained. It is a helpful tool to get us there. We definitely have more cases than our team can keep up with. Every little bit helps. So every person that we're able to get to stay home and not spread it to somebody else will stop that chain of transmission that you saw on that webpage that I showed. So it's definitely one tool that we are using. The other tools that Connie mentioned, those Healthy at Work guidelines, wearing a mask, staying 6 feet apart, not going to places that you don't need to go to for your mental health or sanity. And so especially right now, recommending that you're not going inside a restaurant, not going to a bar, not going to a gym. Use takeout, eat outside, all those good recommendations is what the CDC and federal government are recommending, and since we are in that red zone, that's what we are saying as well.
This one gets a little specific. How certain are you of the testing and tracking protocols? I know certain tests have higher accuracy rates than other tests, and what are your thoughts on as it relates to that?
Yeah, testing is a great tool to help us identify who is sick. It's not perfect. So The better test is the test that takes that 24, 48 hours to come back, which is what we're offering mostly here in Louisville. It's a PCR test. It's kind of like the gold standard. It's if it's positive, you're pretty confident that that is a positive test. If it's negative, you can be pretty confident that that is a negative test. The antigen test, which is a lot of people call it like the rapid test, when you get results in about 15 minutes. If that one's positive, you can be pretty confident that that is positive. If it's negative, it has about a 50% false negative rate. So if you get a negative test for that and you think you have COVID, we're asking you to stay home no matter what that test result is. And so not super helpful in like screening unless you are doing it in a doctor's office and can have that collaboration, or if it's something that you're doing on a every 3 days, every weekly type basis. And so that's not something that the health department has invested in yet, but we've gotten the PCR test up and going. And so it's kind of like our next step after we have enough of that gold standard for that diagnostic. So more of that to come. And I think I answered your question. If there's more clarifying, please ask.
Oh, I'm sure I could keep questions going all afternoon and wear you out. But,
Yeah.
But I'm going to ask if you can do it. Can you go back to the part of your PowerPoint where you had the zip codes of the cases?
Yes. That is on our webpage, so if anyone wants to go back, but this is where all of the cases have been. So darker color, more cases. So not, still caveat, it's not where it currently is, but this is where COVID has been higher throughout the pandemic. So we know some of our lower income zip codes were a lot higher in the beginning of the pandemic because those were our essential workers. Those were our Louisvillians who didn't have jobs or they could stay at home. And so we're going to work. We didn't have as great of workplace guidelines set up, or they're in a factory setting where it's maybe harder to keep that 6 feet apart. And so we had a lot of spread there initially. But now I think a lot of our cases back in July and August were from our higher income zip codes, people that were traveling to Florida and other hot spots and coming back and then spreading it. And now it's just everywhere.
And Dr. Moyer, you actually went directly to what I was noticing here, and we were noticing. And it's a focus of GLI, trying to help some of our more economically challenged and some of these other parts of the city. So, but if I heard you right, you feel like it's improved from where it was a month or two or whatever it was ago, because this is a point of concern I think all of us have. So I just like hearing that it's going the right direction.
I don't know. Yeah, I mean, it's growing. I mean, you see the case counts are too high. We don't have public health capacity. We're not doing our normal tools that we like to do in an outbreak. So I think the message more is that COVID is everywhere. People need to continue to reduce their activities to 25% of normal right now. So if you usually go 4 places in a day, that's just 1. And I know people are not doing that because when I am out on the road, traffic is almost back to normal. So, I mean, that's if you normally see 4 people, we want you to be seeing 1, and preferably that's outside with a mask on, 6 feet apart. Not going to gyms, not doing, normal life is difficult right now if we want to stop the spread of COVID.
Let me add something here that I think is, I know, worrying the clinical professionals, and that's this coming weekend. Dr. Moyer mentioned that the cases that we're seeing are throughout the community, but in homes and gatherings. And we realize that social connectedness is something that we all need. And as we go to parties, etc., in people's homes, and hopefully Mother Nature cooperates and these parties can be outside rather than inside, and that derby masks will serve as the new derby hat, because masks are necessary unless you're eating. And there are some things we can observe in homes that will cut down, especially in certain parts of the community, will cut down on the chance for spread. I guess, and you can correct me, Dr. Moyer, but it'll be 2 weeks from now that we'll know if we had if Derby was a super spreader, so to speak, in homes and in gatherings. We're not asking people not to have them, but have them smaller, have smaller tables and things like that. So,
yeah, I mean, it probably, so COVID grows exponentially. So every one you infect, they infect 2 more people, and so that grows exponentially. So you could see, I think our spike in July, early August was really related to a lot of travel that happened over July 4th. So it really takes about 6 weeks to see the effect. So what people do this weekend, we will see in mid-October. And unfortunately, that's right when people are going to be making the call of whether or not schools can go back. So I really hope that people listen and stay home so my kids can go back to school. That's my goal. So please, stay home, wear a mask, stay outside.
I've got another question, hot off the press here. For businesses with large in-office workforce, do you support cohorts of employees coming to work on certain days, or what is your recommendation?
Connie, do you want to answer that?
Yeah. Yeah, I mean, we support anything that we can do to keep people spaced out. So anything that would help to encourage, and then keeping those cohorts the same. So it's kind of like, what is your social bubble, some people refer to it, or your social contacts. So, you know, for me to work, you know, with the same people repeatedly, that way I'm not expanding my social or work circle. The same thing we talked about this weekend with derby parties or Labor Day parties. We realize that people are going to have those. So if they're outdoors and you're cooking out, maybe not expand too far past your current social circle, or even, you know, potentially a close work circle. So so that would, but how we would recommend, you know, if different or the same people are in the office on the same days. Did that answer the question? Okay.
Yeah, I think so. My example
Okay.
would be, I think what the person's trying to ask, if I've got 200 employees and I can keep them all 6 feet apart, but I would be better to bring 100 in on every other day, so I'm not exposing. So that is your recommendation, is what I think I'm hearing correctly.
Yeah, sure. 100 would be much better than the 200, and the same 100 on those days is even better.
I mean, I know of other businesses we work with, that is what they chose to do. They actually have assigned restrooms of the same group to stay in the same bank of restrooms, to, my term, not yours, but not cross-pollinate system. Then go on to another question, and this is one I don't have a lot of knowledge about. I'm not going to use the term that was asked of me as it related to what they called the test, but the stool test that's being discussed, is that proving to be effective?
I think you're referring to the wastewater kind of surveillance. And yeah, there's been some great studies. We are partnering with U of L to do it here locally. We've got a couple months of data that we're still trying to kind of do what the data people do best to make sure it's accurate. And as soon as we have that, we'll be releasing that to the public. It is a great marker to kind of know. They say, I think it's about a week before somebody normally would test positive, you're able to see evidence. And so it's just a helper for us to know, like, what neighborhoods are seeing high rates, and it'll be a tool that we could use going forward to then target testing in those neighborhoods. So instead of like the zip code map that I showed you, which showed where positive cases were, this will hopefully help us know where they are going and areas that are at increased risk. Still all new. I guess that's the other reminder. COVID's been here for 6 months. We only know 6 months worth of stuff. So I might be telling you something different next time you have me back.
And that leads into the next question, where you teed that one up really well, because this is what makes it challenging, I think, for the public and for business. The new CDC guidelines And I'm going to want you to give us some input. You know, now if it's a short term, they're recommending you're around somebody, you don't need to get tested. I'll use my lens. As it changes, it confuses the public. And then people learned, they lose confidence. It's kind of like if I messed your paycheck up, you're going to lose confidence in my payroll clerk. So maybe you could address that with your thoughts on just, we definitely have a difference of opinion here now with the state of Kentucky and the CDC. That's pretty obvious.
Yeah. No, I mean, testing's tough. So I think the CDC said you don't necessarily need a test. And so, I mean, I think in a sense that's true. I mean, if you're a contact to a case and you stay home, you don't contact anyone else, we should stop the spread of the chain there. But unfortunately, like, we need to know where the positive test was. We could do more contact tracing, but then it goes back to resources and where they are. So what we're recommending in Louisville is that our tests are being prioritized for people who have symptoms. When we look at our data here in Louisville, our positivity rate, so the percentage of tests that come back positive, is a lot higher if you have any symptom, whether that's a cough, a runny nose, diarrhea, headache, something. That test is more likely to be positive than if you were totally healthy and fine. And so want to make sure we have enough tests for people who have symptoms. And then for the asymptomatic or no symptoms, encouraging testing and contacts to cases. There's just a lot of confusion in the public though too. Like, I was next to Connie yesterday. I was a close contact, so I went and got tested today. It was negative. That means I probably didn't get sick the same time she did, but that still means I have to stay home for 14 days because the test isn't going to be positive until I'm about to have symptoms. And so it will be negative probably until day 7 or 10, or who knows. Some people, symptoms start like 3 days after exposure. Some people it's 14, which is why we ask people to stay home for 14 days to monitor for symptoms. And so that's the most important piece. The test is not the golden ticket to be able to go home, to go out, to be able to go back to work. The test just helps get started that contact tracing faster. If it's positive, if it's negative, you still got to stay home, unfortunately, right now. Science is evolving. Hopefully, maybe that'll change, but right now, that's the best tool we have, is just for everyone to stay home and talk to each other on Zoom.
Yeah, and if I can add, when we talk about, you know, the CDC or different guidance change, and it has evolved throughout the pandemic, and some things as we learn more. For one thing, as far as returning to work, once you've been symptomatic or positive, you know, but previously it was 72 hours fever-free without fever-reducing medication. So now that's been changed to 24. So that's good, you know, as far as returning to work or school or those type of activities. So one thing that we're a little hesitant on is printing or posting a lot of the guidelines, because they do evolve, and we don't want somebody to go back to that form that we sent them 3 months ago, and now that it's changed. So even we have to frequently, you know, check the guidelines to make sure that we're meeting the current science and the current data.
Okay, the people on this call that know me know this next question's near and dear to my heart. So this one's coming from me, not from the chat. We're 2 states, but we're one community divided by a river. We live and work going back and forth across that. It's a river, we get over it. I want to talk more specifically how you interact and communicate with your partners on each side of the river at a state level and at a local level. And then to dovetail onto the next piece of that, do you try to learn from other cities throughout the country on what they're doing? So there's 2 questions hiding in there. Thanks.
Yeah, and I can take that. I mean, I know me personally, I talked to all the other health directors on the other side of the river. It was weekly. We've backed it off to every other week because guidelines aren't changing as much as they were initially. And so just be able to communicate, collaborate, just really interested in their case counts, if they're going up and down, also like how full their hospitals are, because we know if their hospital's full, overflow is going to be Jefferson County. Also just seeing like there's at one point in time, like they weren't didn't have as strict of a mask mandate, and they were opening restaurants before us. They opened schools before us, and so just watching those trends have been helpful in just kind of preparing my team for what's to come. And then now we're about similar, so just kind of talking and collaborating back and forth with
Okay.
Indiana.
Yeah, and I
Thank
can
you.
add on, from a workplace standpoint, Southern Indiana is kind of a suburb of Louisville, and we share workplaces. So I know their EPI team and ours are in communication, particularly early on, to identify clusters. If we have an employer here that have not only Jefferson County residents, but the surrounding counties, including those in Southern Indiana. So, it helps us with those communications so we can identify the cluster quicker, where if the cases were spread out through those counties, and we wouldn't, be able to identify that as an area that needs more work.
Yeah, and I'm telling you all what you already know. I mean, I'll use Indiana. You got well over 20% of the workforce going to work in the healthcare systems. They're going south of the river to work, then to come back north of the river. So I mean, there's an enormous back and forth of that. So this question is to Heidi. As board chair, Heidi, what else can businesses do to help in the public health effort?
That is a great question. We ask first for, and this will go to yours, Sarah, hand in partnership as part of a community advisory board so that this conversation today continues on. And being an example for not only your employees and their families, but many times we can probably use technical assistance from loaned executives at the department. And during these times, we're trying to resurrect something called Friends of Public Health, so that we can receive, it's a 501c3 that's basically inactive right now, but so that we can receive both financial and human resource help from business and quite frankly from other nonprofits, et cetera, because at some point the CARES money is going to end, but the issues of public health do not go away. And if there's one insight from the experience in COVID, it is that the community needs to know more about public health, and it takes a village to overcome a natural disaster. And so those are the kinds of things. I mentioned the flu in the beginning. There's so much for business to comprehend and to understand now in terms of return to the workplace. And I just, being a former Humana associate, that's where I got my flu shot. So it's staying aware and keeping this dialogue going to say, there are, for smaller business, chains like CVS will come out or they will go somewhere if you want to bring folks into parking lots and things like that. But really partnering, and you spoke about, or whoever asked the question, the hotspots in the community, ensuring that those who are most vulnerable have access to things like flu shots, and perhaps underwriting in under-resourced areas, and working with faith-based institutions to provide flu shots, et cetera. And so we're trying to build these kinds of partnerships, if that makes sense to folks.
Yeah, it does.
Thank you so much for giving us this opportunity to share.
Well, we appreciate you giving the time. Obviously, our focus is how do we get these businesses back, how do we help them survive? We're going to close out. I'm going to ask Dr. Moyer one last question, and then I'm going to turn it back over to Sarah. And the question is, what is the biggest challenge you see on the horizon, or what's keeping you up at night that you're most worried about going forward from where we are right now?
Honestly, it's my team burning out. I mean, this is a bigger challenge than anything we've had to deal with before. Public health has been under-resourced and underfunded for a lot of years. Did not have the staff to respond to this, so just trying to keep them going and is probably the biggest thing I'm looking at. And I don't know, you guys too, probably running your own businesses. This is, even though our day job is to fight COVID, we're all dealing with COVID in our personal lives as well. And so really there is no place to relax and get away from it. And so just trying to balance that is probably my biggest challenge. On top of growing, I mean, been blessed that there is CARES funding. I mean, we've been growing the department over 20%, have a large contract with Lacuna that is hiring, I mean, over 100% of our department. I mean, we had less than 200 staff to start with, and they're going to be up to 246 by the end of the month. So it's, yeah, challenge. I mean, you guys probably know better than me, and so it would take any advice on how you quickly grow a business without the expertise in the community to do it. I would appreciate that.
I really, really do appreciate your candor on that. That isn't probably what I thought you were going to say, but I'm really glad you did. I can speak, I think, for the entire group on this call. We all are very appreciative of all the efforts you guys are doing and all the people that work with you every day. So keep doing what you're doing. I don't want you to think you're not unloved or underappreciated. We're glad you're there. With that, I'd like to turn it back over to Sarah to close us out. Sarah?
Thank you, Carrie, and thank you so much for your leadership with our task force. I know when I first called Carrie, it was back in March, and typically a task force might last a few months, but we've been in this a little bit longer than that. So I really appreciate Carrie stepping up and leading us through this, and appreciate you, Dr. Moyer, Heidi, Connie. Thank you so much for being with us today to share your expertise. Thank you for your willingness to partner. We're excited about that. So please let us know how we can work together. Let us know what information you need to get out to the business community, because we would love to help you with that. And thanks to each of you for joining us today. As the voice of the business community, we are in this together. I've said that after every webinar. We know this is a challenging time, and we want to be there for you with the latest news and with the latest programs to help your business through this difficult time. So for a summary of today's discussion, for the recording, it is on our website. If you want to send that to anyone in your network, if you think that this information would be valuable to someone who couldn't attend today, please do so. We are going to have our next session coming up on September 9th. It will be with ORI and Steelcase, and they will be talking about bringing people back to work in a safe and productive manner. So please join us for that, and we hope you will stay safe and well, and remember what Dr. Moyer, Heidi, and Connie have said today about having a safe and happy Derby. Thank you so much. Have a great afternoon.